Good afternoon on this lovely Tuesday. I'm Teresa Melito-Conners, Dr. MC of Dr. MC's Self-Care Cabaret. Thank you for joining me today. We have a little bit of an intense topic to discuss, but we are going to look at trauma, resilience, and how self-care plays a factor into all of that. So I am doing a training for the public school district that I work for next week on trauma for the teachers in the district. And as I was doing my research, I realized that this was information I should share here as well for folks. And I put up that meme a couple of days ago talking about it. I got a lot of interest, which was kind of funny. So clearly this is a topic that people are interested in learning more about. So let's dive right in. So, the CDC actually in 2019 indicated that trauma is the largest public health crisis facing children today. That was before the coronavirus. So, certainly, this collective trauma of the coronavirus that we're all experiencing right now is not going to help things. But even before that, the CDC indicated that childhood trauma is a serious issue. So what exactly is trauma? I'm going to give you like formal definitions. So trauma is a deeply disturbing experience. It can be a singular event or a series of events. It can be caused by a stressful occurrence that is outside the range of usual human experience and that would be marked distressing to almost anyone. An experience that causes serious threat to one's life or physical integrity, one's old children, spouse, or others, close relatives, and friends. The sudden destruction of one's home or community, seeing another person who has been injured or killed as a result of an accident or an act of violence. You can experience trauma by witnessing something or being a bystander to something as well. So what can cause trauma? So there's several examples of things that can cause trauma, some of which I already kind of said. But in addition, things like divorce, difficulties when giving birth, losing a parent or a family member, illness, high fevers, poisoning, physical injuries, physical, sexual abuse, emotional abuse, abandonment, witnessing violence, natural disasters, surgeries, prolonged immobilization such as casting and splints. So there's a lot of different things that can cause trauma. And you might be wondering, well, how do we measure this? How can we measure that somebody has experienced trauma? Well, there is a way to do that, and that is called through ACEs, which is your Adverse Childhood Experiences. So your ACEs score kind of indicates how many traumatic events you have experienced. And the higher your ACEs score, the more at risk you are for experiencing issues as an adult. That's not to say that because you experienced something as a child, you're bound to suffer as an adult. There's obviously more that goes into it, but it's just there is a correlation between your adverse childhood experiences score and your adult life. So, the ACEs score was designed in 1995 to 1997 by the CDC. It's a series of 10 questions, and I can post the link later if folks are curious kind of what their own ACEs score is. And in the interest of full disclosure, mine is rather high. So I've done a lot of this work, and I've done a lot of this kind of soul searching and resilience building and self-care and whatnot to kind of overcome obstacles that could have had some traumatic impact on my life as an adult. Oh, somebody's commenting they're not a fan of ACE. ACE is certainly not it's not a perfect system, but it's also not uncommon for people to have, and especially children in Massachusetts, to have 1, 2, 3 for an ACEs score. So I think the statistic is about 40% of children in Massachusetts have at least one ACEs score. And that study was from a few years ago, so it's even higher now. So The original ACEs score, how they did this, because some people figure that, oh, you know, it must have been an at-risk population. It wasn't, whatever. People always try and disprove things. But 17,000 health maintenance organization members from Southern California received physical exams, completed confidential surveys, and current health status and behaviors. All the ACEs questions refer to your life before 18 years old in 3 major categories: abuse, household challenges, and neglect. The people that were in the original study were not an at-risk population. These were employed, white, middle-class, college-educated people with health insurance. And the findings from that are a direct link from childhood trauma and adult onset of chronic disease. So, let's see here. Keep going. So, what do they say that ACEs cause? So, ACEs can cause in later life diabetes, chronic obstructive pulmonary disease, heart disease, high blood pressure, obesity, cancer, liver disease, unintended pregnancies, substance abuse, depression, anxiety, suicide risk, PTSD, injuries, and sexually transmitted diseases. Some of these are due to the correlation between someone having a high ACEs score and engaging in more riskier behavior as a result. So the meme that I posted the other day that got people kind of intrigued said somewhat similar things. It said that if unhealed childhood trauma can manifest itself as being a people pleaser, being infatuated with fixing others, being codependent, needing validation, living your life on high alert, having a fear of abandonment, deprioritizing your own needs, having to constantly prove yourself, tolerating abusive relationships and abusive behaviors from others, attracting narcissistic partners, and difficulty setting boundaries. Those are pretty intense things to experience as an adult, and they can be a result of having experienced childhood trauma. So, there is good news. I don't want you to think this whole session today is going to be on bad news, and we are going to end with a relaxation on healing. So, like I said, ACEs is a series of 10 questions. It's not a perfect system. It doesn't take into account a lot of factors. Some of the questions are ambiguous and can be left up to interpretation, but it's very quick to take the ACEs score. And it asks things such as, did a parent or other adult in your house often swear at you, insult you, put you down, or humiliate you? Another question is, did you often feel that you didn't have enough to eat, had to wear dirty clothes, and had no one to protect you? This gives you an idea. And you just give yourself a point if you have a yes for any of these, and then you add it up at the end. However, how does this relate to self-care? So, in my research, I was also reading about resilience. And resilience is often kind of considered the antidote to trauma. That if you have resilience, then it lessens the impact of trauma. But resilience kind of sounds like this mysterious thing. Like, well, how do we get it? Are we born with it? Can we learn to be more resilient? What is it? So, there is another survey you can take, and there's actually several versions. And it's not supposed to be like, my ACEs score is this, but my resilience score is this, so I'm all set. But what it is you can see, like, kind of if you have the protective factors that maybe helped you or could help you bounce back from traumatic experiences. So the resilience questionnaire asks questions on a scale of definitely true to definitely not true. And they're things like, I believed that my mother loved me when I was little. I've heard that when I was an infant, someone in my family enjoyed playing with me, and I enjoyed it too. When I was a child, teachers, coaches, youth leaders, or ministers were there to help me. So those are some of the questions that lead to us determining whether or not we have a resilience, how our resilience is. Although I already confessed that my ACEs score is high, my resilience score is also very high. So the reason why I wanted to talk about this today, though, is when we think about resilience, and we'll get more into it, the way you build resilience is almost exactly the same as how you practice self-care. So if you're practicing good self-care, good, intentional, consistent, foundational self-care, you are going to build resilience. So resilience, the fancy formal definition is, psychologists define resilience as the process of adapting well in the face of adversity, trauma, tragedy, threats, or significant sources of stress, such as family and relationship problems, serious health problems, or workplace and financial stressors. Bouncing back from these difficult experiences also involves profound personal growth. Trauma does not define you. Resilience does not mean that the person won't experience difficulty or distress. The road to resilience is likely to involve considerable emotional distress. Resilience isn't necessarily a personality trait that only some people possess. Resilience involves behaviors, thoughts, and actions that anyone can learn and develop. The ability to learn resilience is one reason research on resilience has shown resilience is ordinary, not extraordinary. Like building a muscle, increasing your resilience takes time and intentionality. For focusing on 4 core components: connection, wellness, healthy thinking, and meaning. Connection, wellness, healthy thinking, and meaning. So if we think back to our domains of self-care, all those components fall into the domains of self-care. So again, if you are practicing good, consistent, foundational self-care, and you're really getting at all of your domains, you're going to build resilience. And that is going to help you even if you've never experienced a traumatic event. Even if you, all of us at some point will probably experience something traumatic. We all kind of are all going through it right now with COVID, and people are certainly handling that in a variety of ways. But being able to really access your self-care and take care of yourself is going to make you more resilient and ultimately make you better able to cope. So the resilience survey that we talked about, you can access that online as well. It was not developed for research. It's not meant to be a counterpart to ACEs. It's just over time it's kind of morphed into that. But, especially when we think about children and trauma, in addition to being an indicator of having issues later in life, it also impacts the developing brain in a lot of ways. So if you're working with children who have trauma, or children who have experienced trauma, you want to be working with them to help build their resilience, as it can have a lot of damaging impact on their developing brains. Things such as hormone levels, immune system, neurobiological changes. If you look at a scan of a non-traumatized child versus the brain scan of a traumatized child, there is a dramatic difference in that. I don't want to go too far into that right now, but one of the key components for building resilience is relationships, and that is one of the domains of self-care that we talk about. Also, I'm trying to get to my self-care section in my slideshows. I printed out what I'm presenting next week. All right, so nutrition and hydration. We'll go through the 10 domains real quick. Nutrition and hydration, right? How we feed our body, how we nourish our body, that helps us function well. Exercise actually helps eliminate anxiety and stress. It's a great way to help build resilience. Soothing strategies, deep breathing, calming the nervous system, thinking about calming things, doing things creative to relax, using smells, self-awareness and mindfulness, calming our thoughts. So we can see, hopefully you're starting to make the connection between resilience, trauma, and self-care. The rest of the domains of self-care: rest, relationships, a really, really important one, especially for healing trauma. If you don't have supportive people in your life or people you can go to, you can seek the help of a therapist or some sort of support group and find find that support that you need to access that domain. Someone's asking about, remind me the place to learn the best about the domains. We talked about them on one of the earlier Facebook Live sessions. I've written about them on my blog as well at drmcselfcare.com. I will post, it comes from Cook Cotton, Dr. Cook Cotton's research. I can post a link later also to some of her research, which outlines the 10 domains. So you got relationships, physical, medical, how we take care of ourselves, physically and medically, going to the doctor, going to the dentist, all that good stuff. Environmental domain, our space, self-compassion, that's going to be another big one for healing trauma, and the spiritual domain, so finding meaning. So that's another big domain for healing trauma. When you feel like you are hopeless and no good and worthless and you can't see a larger meaning and a larger purpose for yourself, that can be, that's not good. So, but when you can see those things, then you're better able to, find purpose and find meaning, which will help build your resilience, will to ultimately help heal trauma. Cool. I also do want to talk very briefly about misconceptions about trauma. Also, if anyone is looking for, they're really interested in this, wow, this trauma research is kind of cool. It is really cool. It can get pretty heavy and it can get pretty dark. And this is beyond, the ACEs score. This is going into real trauma research. I strongly recommend a book by Dr. Bessel van der Kolk called The Body Keeps the Score. That is a really eye-opening book. I will warn you though, it is not. This isn't light beach day reading. This is pretty heavy. But he was one of, if not the doctor to come up with the diagnosis of PTSD in our soldiers coming back from war. And so he talks a lot about in the book. It's been a couple of years since I've read it, but he talks a lot about those experiences and learning about the trauma, and he shares those experiences and other people who have lived through really really traumatic events and kind of their stories. So it's a wonderful book to learn a lot about trauma, but I will warn you, it's not necessarily a light read. So misconceptions about trauma. So trauma can't trigger lifelong behavior and mental health. That's a misconception. Many children who have experienced trauma are also struggling with some of the most common behavioral problems, such as oppositional defiance disorder, conduct disorder, ADHD, etc. Most children who are severely affected by trauma are diagnosed with traumatic stress disorder. That is a misconception. People just think that if you have trauma, you must obviously have PTSD. That's not necessary. And yes, someone's asking me to put the book in the message. Yes, I will. At the end of this, it's hard for me to talk and think and type, so I will respond later when we end the live session, and I'll put all these resources in the comments for people. Bessel van der Kolk's work is phenomenal. People also think that trauma is short-term. The effects of trauma can be lifelong. It's not something like, oh, you had this one experience and kind of get over it and it won't impact you anymore. Traumatized children don't do bad things. It's another misconception. Some traumatized children do bad things as a result of their trauma, and it's common to think that a teen will just grow out of it, but that's not necessarily true. There needs to be some sort of intentional therapy and intervention and support in order for the child to be able to overcome it. Trauma couldn't possibly affect the brain and body long after the trauma. This is another misconception. People think that children are very resilient when they're super young, so they just kind of get over it if something really bad happens to them. But in reality, and sometimes that's true, and then they don't start showing signs of the impact of the trauma until they're 9 to 12 years old, and then everybody's shocked because it seemed to have come out of the blue. But if you really look back in the history, you can see that they actually did have a traumatic experience when they were much younger. It just didn't show itself until a lot later. With help, anyone can get over trauma. That's another misconception. Trauma does not have to be a life sentence. However, it is very complex, and the healing process can be very complex and really individualized to the person. There's all these factors: what you've experienced is your ACEs, how you score in resilience, what you've done to protect yourself and heal yourself. That all plays a factor into how this is going to impact you. So everyone is going to be different with that. But it doesn't mean that if you experience trauma as a child or a young adult, that you're doomed. Just because you've experienced trauma, you can absolutely grow into a healthy, functioning adult and have a long, healthy, prosperous life. If you don't see the trauma, it can't affect you. That is also not true. This goes into a lot of frontline workers, EMTs, first responders experience a lot of vicarious trauma or secondary trauma because they see all these horrific events, and then you start to kind of, if you're not protecting your own energy in that, you start to take it on yourself, and then you experience vicarious or secondary trauma. So, trauma is not the same thing as PTSD. Humans naturally seek out meaning as a way to make sense of the world. That's another misconception. Survivors often feel guilty and ashamed of their trauma, so unless they're shown and supported and helped to find meaning, they're not just going to automatically heal themselves. This is intentional work. And then there's other people that feel, another misconception is that it's only at-risk populations that experience trauma. If you remember back when I first explained the ACEs score, the ACEs original study back in 1995 to 1997, it was white, middle-class, educated folks that were the participants in that study. Not typically what you think of when you think of an at-risk population, so that is also a misconception. Also, parents that abuse substances can be traumatizing to their children for a variety of reasons, but there's some people that believe that just because a parent does drugs or drinks excessively, it's not going to impact the child. It absolutely can. So, that's that. So, going back to self-care for a second, when we think about self-care, when we practice, again, consistent, foundational, regular self-care, what we are doing is we can then control our body's response to stress and other things occurring in our life. We can never control what happens outside of our bodies. We can never control what other people are going to do, what the world is going to do. We can't control COVID-19, but what we can control is our response. Our bodies, our mind, our thought processes, we can control that. And you do that by self-care, by adopting a routine that helps you with breathing exercises and meditation and mindfulness and exercise and things that bring you joy and rest. That's how we control our response. That's where your power is. And when you can take care of yourself at that level, you are better to care for others. So I think that's enough on trauma. And I thought we would kind of theme today's session by talking about trauma. I like to end with a guided meditation. I don't have a card pull for you today, but I do have a guided meditation, a relaxation to promote physical healing. I figured if we were going to talk about trauma, we should do a guided meditation to help support healing. So I will lead you through this, and that'll be it for today. This one's a tad longer than I usually do, so get comfy. And as always, these videos are available afterwards on my Facebook page, on Dr. MC's Self-Care Cabaret, and you can access the recordings and the guided meditations and all that stuff later at your convenience if you want to rewatch it or share it with someone. So, this healing relaxation begins with a passive progressive muscle relaxation and then guides you to imagine your body healing itself. Begin by finding a comfortable, relaxed position. Allow your body to begin to relax. Breathe in and out. Take a cleansing breath in and breathe out the tension in your body. Feel relaxation beginning at the bottom of your feet. It might feel like stepping into a warm bathtub, or it may feel like a tingling sensation, or simply calm and loose. Allow the relaxation to spread over your feet and up to your ankles. Feel the relaxation rising above your ankles, flowing up your lower legs to your knees, continuing up to your upper legs. Allow the relaxation to continue to spread throughout your body. Rising now to your hips and pelvic area, to your stomach and lower back, to your chest and upper back. Let your upper arms relax, your elbows, lower arms, and wrists. Feel the relaxation spread to your hands, relaxing the palms of your hands, the back of your hands, each finger and thumb. Your hands feel pleasantly warm, heavy, and relaxed. Feel your body relaxing further as the area by your collarbone widens and relaxes, allowing your shoulders to ease back slightly. Allow your upper back to relax even further. Let your shoulders relax and your neck. Feel the relaxation continue to spread to your chin, the back of your head, your mouth, your cheeks, nose, eyes. Feel your eyelids heavy and relaxed. Notice your eyebrows relaxing, your ears relaxing, and your forehead. Your forehead feels cool and relaxed. Let the relaxation spread further to the top of your head. Your entire body now is relaxed and calm. Feel the relaxation flowing throughout your body, from your head to your feet. You can relax even further as you let your spine relax completely. Starting with the top of your spine meet your head, feel the relaxation. Feel the muscles giving up their hold and relaxing. Feel the relaxation spread down your spine, down your neck, middle back, lower back, all the way down to your tailbone at the bottom of your spine. Notice all of the muscles of your back relaxing completely. Feel the relaxation flowing throughout your body. Breathe in. Now hold that breath and relax your muscles totally, allowing the breath to flow gently out your nose or mouth. Take another deep breath, breathing in relaxation, and release the breath. Breathe out any remaining tension. Continue to breathe smoothly and slowly as you mentally scan your body, looking for any remaining tension. If you notice any tension, focus on that area. Direct the relaxation to flow to that area and then carry the tension away. Imagine that the air you are breathing can cleanse your body and remove tension. Imagine that each breath in carries relaxation. Picture the tension in your body leaving with each breath out. Now simply relax, calmly, enjoying the feeling of relaxation for a few moments. Focus your attention now on your body and think about the healing that needs to take place. Create an image in your mind of your current state of being. Imagine the physical ailment that troubles you. It might be pain, or illness, or injury. It might be something diagnosed, or maybe a problem that is not yet identified. Whatever it is that you would like to heal, imagine this problem in your mind right now. Focus on the specific location in your body where the problem is present. You might want to imagine the problem as a dark area and picture the healing relaxation as light. See the light of relaxation flowing through your body. Direct the light of healing, relaxation, toward the dark area. Your body has many ways of healing itself. See the healing relaxation promoting your immune system, promoting strength, promoting growth of healthy tissue, removing unhealthy matter from your body, removing toxins, bacteria, or waste, cleaning up your body. Imagine the light of healing relaxation flowing, swirling, touching the edges of the dark problem area in your body. You might notice small pieces of the dark area being carried away by the healing relaxation. Allow these dark pieces to leave your body as you breathe out. Breathe in health, healing, and calm. Breathe out tension, illness, and any problems in your body. Allow the light healing relaxation to continue swirling around the dark problem area. See the dark problem area getting smaller. Imagine the dark area completely enveloped by relaxation. See the healing relaxation making the dark area lighter and lighter, carrying away anything that is not good for your body. Imagine your immune system working to heal you. Picture the cells you need going to the places they need to go, working as needed to heal your body. Imagine the healing relaxation flowing, coursing through your body. Picture your body entirely filled with relaxation. See the problem area in your body is healing. See it becoming even lighter, filled with relaxation, carrying away any discomfort, healing. Allow your body to heal itself. Take a cleansing breath in and breathe out what your body does not need. Breathe in relaxation. Breathe out all the old air. Relax for a few moments and imagine the healing process going on inside your body, feeling confident in your body's ability to heal, feeling calm and at peace. Now you can choose to return to your usual level of wakefulness and alertness, or drift into sleep. If you choose to awaken, feel your body and mind becoming more aware of your surroundings. If you decide to sleep, let the relaxation deepen. I will count to 3. When I reach 3, you will be at your desired level of relaxation or alertness. 1, 2, 3. Thank you. That was the Healing Relaxation to Promote Physical Healing from Inner Health Studio. They really have beautiful guided meditation scripts available, and that's what I've been using every week when we do a guided meditation. So thank you for joining me here. I will post those links when the video is available later on the page, which just takes a couple of minutes. And that's all. And as always, please follow me on Facebook. Invite your friends, please, to join me at Dr. MC's Self-Care Cabaret. We can help other people take better care of themselves, and you can help me grow my online community so I can do more things and take the next steps that I want to take with Dr. MC's Self-Care Cabaret. And you can subscribe to my weekly blog on my website at drmcselfcare.com. That's drmcselfcare.com. I definitely, some people are thanking me. You're welcome. I'm glad. My last couple of blog posts have actually been about the zodiac and self-care signs. So if anybody's a Gemini or a Cancer, I've got those posts up already, and those are pretty cool. So that's a little intriguing. I'm kind of fascinated by the zodiac, always have been, and the intersection of self-care and your zodiac sign is kind of fascinating to me. So anyway, as always, thank you so much for joining me. I look forward to seeing you every week, and stay well, and I'll talk to you soon. Bye.